welcome to Longevity Personalized. I'm Veronica Gordon. I'm a life coach, and I'm here with Dr. Mark Gordon, a board-certified cardiologist. Welcome, Dr. Gordon.
Thanks, Veronica. It's a pleasure to be here.
And today we're here to talk about how to prevent a heart attack.
So we're excited to share with you guys some information about some new technology that can actually help you prevent a heart attack.
So who's at risk?
Well, the typical risk factors that everybody talks about are high cholesterol, high blood pressure, smoking, diabetes, and family history of heart disease. But there's an additional 25 or so further risk factors that people really don't talk about.
So what causes a heart attack?
When a person's having a heart attack, a plaque in one of their coronary arteries ruptures, and the body tries to heal that by forming a blood clot. As the blood clot grows, it eventually plugs up the entire artery so that the blood flow downstream stops. The heart muscle then past the blockage dies.
So what can we do to prevent a heart attack?
Well, to look for signs of heart disease in the past, people have typically done stress tests. But stress tests are notoriously inaccurate. They have an accuracy of about 70 to 75%.
Oh, wow.
But that's only to detect a blockage of at least 70%. So if you have any narrowing, any plaque in your arteries up to that point, a stress test won't detect it.
So what other tests are available?
Well, the coronary CT angiogram has been around for about 20 years now, and the technology has improved with better scanners and so forth. But recently, there's been a new breakthrough. There's a new technology, it's artificial intelligence, that can actually analyze a coronary CT angiogram, and with a very, very high degree of precision and accuracy, it can tell you precisely what your risk is.
So he's talking about Cleerly. So tell us about Cleerly.
So Cleerly is an artificial intelligence program we've been using here with our clients for about 3 years. And it looks at the CT angiogram data, and it differentiates the plaque between the soft stable and the soft unstable plaque. So if you've got one of those plaques that's ready to rupture, like for a heart attack, we can detect that with this particular scan. And it also gives you the total amount of plaque in all of your coronary arteries, so it's something that you can follow over time, get another scan a year or so later, see if you're laying down more plaque or if you're having a regression of plaque or what's going on. And it's just been such a great technology for us to be able to do all of those things and give our patients a very, very precise risk assessment.
And what age would you recommend getting the Cleerly?
I recommend everybody gets a Cleerly scan. It should be a screening test, just like mammograms for breast cancer or colonoscopies for colon cancer. And if you've got significant risk factors, you should probably get one early in your 20s or 30s. But if not, then perhaps 40 would be a good age to consider having one done.
Amazing. So if you're listening, Cleerly, you should get your Cleerly.
I couldn't agree more.
So how does a person order their test?
Well, below this video, there's a link to our website, and that takes you to our Cleerly page where you can get more information, and you can additionally go ahead and order your scan there if you'd like to proceed.
Well, we appreciate you joining us. Until the next time.
Here's to your health.
Take care.